H. pylori doesn't just irritate your stomach. It scrambles your entire digestive power and cascade from the top down. And that changes everything about how your body handles food while the infection is active or hidden in some cases. Most people are just told to eat bland and soft food and to power through it or take antacids, but bland isn't the point. If you're eating without understanding what H. pylori actually did to your digestion, even the right foods can backfire. I'm Dr. Kenny, an IFM certified functional medicine practitioner, and in this video, I'm breaking down exactly what to eat with H. pylori and the mechanism behind why each food actually moves the needle. Before we talk about food, we need to talk about the system you're trying to affect, because H. pylori doesn't just cause stomach pain or acid reflux, it disrupts a sequence. Here's how this cascade works. H. pylori produces an enzyme called urease, and what it does is it neutralizes your stomach acid so that it can survive. That acid suppression, sometimes counterintuitive, has consequences that snowballs through your entire digestive tract. Step one, of course, is that your stomach acid strength drops. Without adequate stomach acid, your stomach can't activate specific enzymes that help to break down protein. Protein can sit in your stomach, partially digested, and ultimately doesn't get absorbed as efficiently throughout the body. Protein, of course, is incredibly important to shift your body into repair, no matter what system we're talking about. Step two is that weak stomach acid means that both your pancreas and your gallbladder don't get the proper chemical trigger to release their own enzymes and bile. So this also affects how fat digestion takes place, as well as carbohydrate in many people. That entire enzymatic relay doesn't fire properly and support your digestion. Step three is stomach acid is also important to signal the moving of food throughout the body. So food moves more slowly in the presence of H. pylori. The emptying of food out of your stomach is delayed, your motility slows down, and constipation can be quite common. What also happens is bacteria will ferment what should have been digested earlier on, and you get the gas, you get the bloating, or the heavy pressure under your ribs when you're eating. Here's why this matters when it comes to food decisions while you have H. pylori. Different food categories trigger different steps in that cascade. And you're not just eating to avoid pain, you're eating to support the specific steps that H. pylori has disrupted. And if you don't know which step a food is targeting, then you can't necessarily sequence it intelligently and support your healing from the inside out. That's what we're building today, an approach that matches this cascade, not just a list of safe foods and unsafe options. The first step that H. pylori disrupts is the mucosal lining in the stomach acid environment. So the first food priority is reducing the mechanical and the chemical demand on that lining while we're giving it the raw materials it needs to repair. That means soft, cooked, moisture-retained proteins ideally. Slow-cooked chicken, soups, stews, shredded fish, ground meat. The cooking method matters here too, just as much as the source of protein. Here's the mechanism. When protein is cooked, and especially when moisture is added at lower temperatures, the muscle fibers break down before they reach your stomach more effectively. Since you likely already have suppressed functioning of the stomach enzymes that support digestion, they don't have to work as hard to begin the process. You're essentially pre-processing the most demanded macronutrient, which is protein, for a system that's currently running on a less efficient output of enzymes. Bone broth sits in this category too because it contains glycine and proline and other amino acids that support repair at this mucosal layer, and it arrives in a form that requires almost no digestive work to absorb. It's one of those foods that can simultaneously support the lining, but also reduce the digestive power that it takes to break it down at the same time. What you're not eating also matters in this category. So dry, chewy, fibrous proteins, grilled steak, high heat cooking, and tough cuts, or even jerky. These require a level of acid and enzyme activity that the H. pylori just disrupts and you can't reliably power through. They can just increase the potential that that partially digested protein sits in the stomach and the intestines longer, which can create additional bloating and pressure. The next category is something that none of the others really do. It targets the H. pylori a bit more directly according to the research, not just the symptoms that it creates. Broccoli, cabbage, and particularly broccoli sprouts contain a compound called sulforaphane. Sulforaphane activates particular pathways called NRF2 pathways. And what this does is it increases the body's own antioxidant production. In the context of H. pylori, this matters because the infection itself creates significant oxidative stress, which is what antioxidants are designed to combat. That oxidative damage is part of why the lining can become inflamed and compromised during both an active or a hidden infection. A recent clinical trial was published in Cancer Prevention Research, and it followed 48 individuals that were randomized to either a sulforaphane-rich broccoli sprouts diet or a placebo for 8 weeks. The group that was eating the broccoli sprouts showed measurable reductions in the H. pylori numbers throughout the stomach, as well as decreased markers of stomach inflammation. The effect did not last after the intervention stopped, however, but it was real and manageable while they were eating the broccoli sprouts. And by the way, if you want a full breakdown of that research and the other citations in this video, I've included a free research summary in the pinned comment and description below. It's free, plain language, and gives my take in addition to the citations. And by the way, when it comes to the cruciferous vegetables like the broccoli, cabbage, Brussels sprouts, that cooked part matters. Raw cruciferous vegetables, particularly cauliflower and raw broccoli, are harder to digest when your enzymes are already affected by the presence of H. pylori. So steam them, saute them gently, or add them to soups and stews. Broccoli sprouts are the exception. They're naturally more soft and they can be consumed lightly without cooking in salads, for instance. Cabbage is also worth signaling out here because traditionally, fresh cabbage juice has been used to support gastric ulcer healing, and this research goes back decades. The glutamine content, which is an amino acid in cabbage, supports the mucosal repair piece, but also the sulforaphane content works on the bacterial and oxidative stress side. It's working 2 steps of this cascade simultaneously. This next category doesn't work the way most people think that it does. People hear the words like anti-inflammatory foods and they think that it's just reducing redness or burning somewhere. What polyphenols are actually doing in the context of H. pylori is something more specific than that. Polyphenols are the chemical compounds that give many fruits and vegetables their bright colors. H. pylori survives in the stomach by adhering to the gastric mucosal layer as well. And it uses specific proteins called adhesins, appropriately named, to stick to that surface. And they essentially resist being cleared by doing this. Research published in the British Medical Journal examined the evidence of polyphenol intake and H. pylori, and it found that certain polyphenols, particularly those found in cranberry, can inhibit H. pylori's ability to adhere to the surface of your stomach. The mechanism by which it does this is competitive. The polyphenols actually occupy some of the same binding sites that the bacteria use to anchor themselves. This is a meaningful distinction from simply killing H. pylori or kill protocols, which is what eradication treatments do, whether natural or prescription. Reducing the ability to adhere doesn't eradicate the infection itself, but it changes the environment the bacteria are operating in, and it makes it less stable and less supportive ultimately. This can be a great adjunct treatment to whatever additional treatment approach that you use alongside diet. The most clinically relevant sources currently are cranberry, blueberries, pomegranate, and turmeric with black pepper. One practical note on the cranberry piece as well is the research uses whole cranberry or unsweetened cranberry concentrate, not commercial cocktails that are loaded with added sugar or alternative sweeteners. That alone can simply counteract the benefit. If you're using juice, it needs to be 100% cranberry with no added sweeteners. The next category also gets overlooked in H. pylori food guidance often, and it's one that targets the downstream steps of the cascade more directly. When the strength of your stomach acid lowers due to H. pylori being present, the signals that tell your pancreas, your gallbladder, and your small intestine to release their own enzymes for digestion, become more weak. You can support that signaling through foods that gently and naturally stimulate bile and digestive enzyme secretion without adding the burden of acid to an already irritated stomach. The most practical ones are your more bitter foods. The bitter flavor in particular stimulates the gallbladder and other digestive enzymes. Think leafy greens like arugula, beet greens, dandelion greens, and artichoke hearts. In a compromised H. pylori environment, they can help to compensate partially that weakened signaling that's taking place. Beet and root vegetables go a long way here in this conversation too, because they support the liver and the bile function. This matters because that affects fat digestion and the absorption of fat-soluble vitamins. So eating these regularly help to keep that gallbladder and bile side of the cascade moving while the stomach is still compromised. Make sure to avoid the raw, fibrous versions of these vegetables during active infections or flares as well. Cooked, steamed, and even blended is the rule here. The digestive benefit of these foods comes from their compounds and their signals, not from just the fiber load. And that raw fiber can just add a little extra burden to your digestive power. This next section is foods to avoid. And this is where people make some big mistakes, usually with good intentions, but where the marketing language often gets oversimplified. Apple cider vinegar, betaine HCl capsules, or high-dose digestive bitters, or even concentrated acid supplements. These are often recommended in functional health circles for low stomach acid, and they are appropriate to use sometimes. But active H. pylori infection and even hidden H. pylori is not always one of those times. The reason is when H. pylori is present and it's burrowing itself into the layers of your stomach and creating a more alkaline environment around it. If you add external acid, whether from apple cider vinegar or hydrochloric acid supplements, what you're doing is you're increasing the acid level of an already inflamed and potentially compromised mucosal barrier. That can drive the bacteria to behave even differently, making it harder to reach them with treatment, or, of course, can just drive symptoms like stark acid reflux and beyond. So the sequencing here matters tremendously. Help give the body the materials it needs to repair in a big way before addressing the infection or even the stomach acid directly. It's important to understand too that with this 4-category approach to foods that help support H. pylori, they don't directly eradicate the bacteria. Food is a support system for the terrain, while the treatments that you may land on do their work. The two are not competing with one another either. They are complementary parts of the same process. If you're not on a treatment plan, whether conventional antibiotics or an evidence-informed herbal approach, the food strategy alone isn't necessarily going to clear your infection. If this sounds like the kind of pattern you've been trying to organize around a systems functional approach to healing, and you're in one of the states that I practice, feel free to request and apply for a health mystery map call. It's an opportunity to talk with me one-on-one about your case and see if it's a good fit for my approach. If you've been dealing with H. pylori and other connections through other systems throughout the body, this is the video that YouTube thinks you're going to like next. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.